America's waistline is expanding, and so is the debate over what this means for our health and our culture. In just 3 generations, obesity rates have more than tripled, transforming not only our bodies, but the very shape of our daily lives. You see bigger airplane seats, clothing sizes, even mannequins have gotten larger, and so have the rates of diabetes, heart disease, and other preventable conditions. And joining us now to discuss is Dr. Joseph Varon, President and Chief Medical Officer of the Independent Medical Alliance. Welcome back to the National News Desk, Doctor. Great to see you.
Thank you for having me.
You know, over the past few decades, the idea of what's normal when it comes to body size has really shifted. So why do you think that's changed, and how dangerous has that become for our society?
Well, first of all, we have normalized illness. What we used to consider unhealthy now is, and that shift has happened slowly, and it's very dangerous because the body doesn't really care what is trendy. It responds biologically. So we're seeing more diabetes, more fatty liver, more hypertension in children. So when a disease becomes normal, prevention disappears. We have anesthetized ourselves to the warning signs that used to alarm us.
Yeah, and where's the line between, being supportive, I guess, and really ignoring genuine health risks? Because you're right, this has become so normalized in our society that this is okay.
Well, we have built an environment that promotes obesity. Our food supply is dominated by highly ultra-processed, ultra-high calorie, low-nutrient products. We sit all day, we sleep too little, we live under constant stress. All of this shift your biological hormones towards fat storage. Even architecture plays a role, escalators instead of stairs.
Yep.
I mean, people drive instead of walking. Nobody walks. I mean, we have really changed this lifestyle by making obesity, quote unquote, normal.
So when you think about how we've changed as a society, do you feel then that there is a necessity then for these GLP-1 drugs that are really helping people lose weight?
GLP-1 drugs are very powerful tools, but they're not magic solutions. That's the first thing that you need to understand. They can reset appetite, they help some patients break the cycle, but they don't fix the environment that caused the problem. That is the problem that we see. When you stop them, most people gain their weight back because their lifestyle is completely unchanged. So we can use them as a bridge, not as a crutch. And the danger is outsourcing discipline to a syringe. So basically, we're telling people, you don't have to exercise, just get this shot once a week and then you're done.
Yeah, let me ask you something about that, though, because, you said something very important, and you said when they get off the drugs, they start to gain weight. Why do they have to get off the drugs? Because food is also a drug.
Yeah, well, they don't have to get off the drug, but the fact is that GLP-1s do come with side effects. You get a GLP-1 stomach, you get skin issues, there are many other issues, and sometimes you are already way too thin. So you are basically the opposite. So a lot of healthcare providers are taking their patients off GLP-1.
Do you think that we're going to see some major issues with the GLP-1 drug, 20 years from now?
Absolutely, no question about it. I mean, we are already seeing them. We are already seeing them the way we are dosing them right now. Maybe we're going to have to come up with a way by which persons are given GLP-1s for a precise period of time, and then we stop them. And, we cannot use them for more than that period of time.
Now, if you could recommend just a few realistic steps for families, for people to start turning this trend around, what would you say? Because I think it's so important that it's easy for someone who is in shape to say, oh, just eat less or exercise more. I mean, they already know. People who are overweight don't want to be overweight. They know all these things, and they don't do those things for reasons that, that we might not understand, mental, whatever it is. So what would you say that can actually turn that around?
Well, there are 5 things that I think you should do. Number 1, eat real food. Shop the perimeter of the grocery store. Fresh, simple, things that you can recognize. Don't go for the fancy boxes that have lots of colors that are telling you, buy me, buy me, buy me. Move daily, walk, climb stairs. I mean, instead of using the elevator, use the stairs. Stand more. I mean, there are some people that have these standing desks nowadays. Movement is medicine. Sleep and distress. Remember that when you sleep, hormones that control hunger are secreted during sleep and distress. So that's important. One very important one: educate children early. Teach them what a healthy food is. I mean, before you start teaching them what the market wants to teach them. And more importantly, build a health cultures. I mean, the health culture that is in the family plan, in the workplace, in school. The body is very smart at forgiving things. Once we stop abusing your body gets used to this new you,
Yeah.
and wants to continue to be like that.
All right, doctor. Always great to see you. And to learn more about this, you can visit imahealth.org.